safe practice. And now I would really happy to introduce to you Associate Professor Jane Purkis. She's a Principal Research Fellow at the Centre of Health Policy Programs and Economics, Melbourne School of Population Health, University of Melbourne, which is a big title, but I've worked with Jane in various different forums over the years. She's been an active contributor to Suicide Prevention Australia network, and she's also heads up the International Association of Suicide Prevention Media Task Force. So she knows a few things about this area, and Jane's also been a really fantastic person to work with on this series, and thank you, Jane, for coming over the ditch and contributing to this work. It's really, really appreciated. So Jane, Suicide in the Media.
Thank you, Merrin, and thank you very much to Spins for inviting me, and it's my pleasure to come across the ditch. I got asked to talk about some of the research evidence in the area of suicide in the media. So I thought I'd talk about... Oh, Sarah's stopping me already. So I thought I'd talk about what we know and what we don't know in the area of suicide prevention. And there's quite a lot we know, but there's still a lot that we don't know. So I thought I'd specifically talk about what we know and what we don't know about the relationship between media reporting of suicide and actual suicidal behaviour, that notion of copycat behaviours. And then I thought I'd talk a bit about the development, dissemination and impact of resources that have been developed around the world and particularly in Australia on media reporting of suicide. So I'll start, as I said, with the area of the observed relationship between media reporting of suicide, reports in newspapers, television, and also I'll talk a little bit about entertainment media depicting suicide and the impact that can have on actual suicidal behaviour. So the reason that we became interested in this, it's not a new phenomenon. The Werther effect was first observed in the 1700s when Goethe wrote a novel called The Sufferings of Young Werther. Young Werther was from a poor family. He fell in love with a woman who was completely out of his reach, who was from a rich family, emotionally this was just beyond him. So he sat at his desk. He was dressed in a yellow waistcoat, blue trousers, sat at his desk with a gun and took his own life. The book was widely read in many European countries, and after the release of the book there were a spate of suicides, and there was good anecdotal evidence that the book had influenced those suicides. So they were particularly by young men of Werther's age. Often these men were dressed in a similar fashion to Werther. They used the same method as Werther, and often the book was found at the site of the suicide, which led to the book being banned in a number of European countries. So, quite early on there was some interest in the area and good evidence that the media, and in this case the fictional media, could have some impact. For a long time the evidence remained anecdotal, but since the 1970s at least 100 really quite well-designed studies have been conducted internationally looking at the relationship between media reporting of suicide and actual suicidal behaviour. So what I thought I'd do was I thought I'd give you some examples of some of those studies, the way they've been done, the places they've been done, the kinds of information they've covered. So I'll give you a few examples and then I'll summarise the evidence more broadly in terms of what I think it means. So the first study was done by a man called Phillips in the US, who was the person who coined the term the Werther effect. He became very interested in the novel by Goethe. So what he did was look at the number of US suicides nationally in the months in which a front-page suicide article appeared in the New York Times between 1947 and 1968, so over quite a long period. And he compared these numbers with the number of suicides in the corresponding months in which no such suicide article appeared. And he found a statistically significant increase in the observed number of suicides in those months after 26 out of a total of 33 front-page articles. So that's a good starting point for the evidence. 26 out of 33 is quite a large number, and they were significant increases. He also observed that the more days on which a story appeared on the front page, the greater the rise in suicides after that story. So the greater the repetition, perhaps more prominent the story. In Australia, Riaz Hassan in 1995 did a study, and it's again similar kind of study. He looked at Australian national suicide rates before and after what he called high impact stories. So stories that were either on the front page or very prominent in size, large stories, published in two of our main newspapers, The Age and the Sydney Morning Herald, between 1981 and 1990. And he also found that the national daily average suicide rate increased after such stories, but only for males, not for females. Much more recently, so this year in fact, Paul Yip, who's from Hong Kong, did some work looking at whether the reporting of 3 particular celebrity suicides in 3 different Asian countries, Hong Kong, Taiwan and South Korea, led to increases in suicide rates. He found that there was a 25% increase in the risk of suicide in the 4 weeks following the report when he aggregated the data from those 3 countries. The increase was greater, so it was 49% in terms of suicide rates among people of the same age-sex group as the celebrity whose death had been reported in the media. So 2 of them were males and 1 of them was a female, and they were quite young. They were all entertainment celebrities. And even more strikingly, perhaps, he found that there was an even greater increase, a 63% increase in suicides by the same method as that chosen by the celebrity. So that the celebrities died in different ways, and in each of those countries there was a particular increase in suicides by that method following the reporting of the death. Paul also looked at the timing, and he found that the effect was greatest in the first week, so immediately after the publication of the media item, and it had attenuated by the 4th week. I should say that in all of these studies, and in the studies I'll talk about subsequently, the observed increase is a genuine increase. It's not just suicides that might have occurred anyway being brought forward. So if that was the case, if it was suicides being brought forward, you'd expect to see a commensurate decrease a bit further along the track, but you just don't. It's a genuine increase in suicides. Elmar Etzersdorfer did some work too. He's in Austria, and he looked at changes in Austrian suicides in the 3 weeks prior to and the 3 weeks following the reporting of a celebrity suicide by gunshot in the country's major tabloid. It's a tabloid that has coverage of the whole country in 1990. And again, he found a significant increase in firearm suicides, so suicides by the same method between the 2 periods, which was not apparent in any other year. And he found also, interestingly, that the increases were highest in regions with the widest distribution of the tabloid, which I guess is a proxy for exposure to the media items. Just looking at my own notes on the screen reminds me of something else I should say, that several studies, as I've indicated, have found that there's an increase in suicides by the particular method that's depicted in the media, but there's not a substitution effect. It's not that there's a reduction in suicides by other methods. Again, it's this genuine increase in suicides overall. So increase in suicides by the particular method and in the overall suicide rate. Schmidtke and Hafner did a slightly different study. They looked at fictional media, entertainment media, and they used what's known as an A-B-A-B-A design. So they introduced they didn't introduce it. There was a 6-episode series shown on television in Germany, once in 1981 and once in 1982, which showed the railway suicide of a 19-year-old student. So they did the same thing as the other studies I've talked about. They looked at the suicide rates before and after the screening of the series, but they had the opportunity to do it twice, which lent greater weight to the evidence. So they found that after each screening, there was a significant increase in suicides by the same method, so again, railway suicides in this instance. And they found the effect lasted for at least 70 days and was most marked again for those in the same age group as the student depicted in the television film. Keith Horton also did a study. He's done several studies in the area actually, but this particular study also used fictional media, entertainment media. He looked at an episode of a series called Casualty, which we have in Australia. I don't know if you have here. It's a hospital drama. And there was a paracetamol overdose depicted in a particular episode of Casualty. He found that led to increases in emergency department presentations for deliberate self-poisoning in the area he was working in, near Oxford. He found that the presentations to the emergency department increased by 17% in the week immediately following the broadcast. He was able to do something interesting because he was considering attempted suicide rather than completed suicide. So he was able to interview people who had fronted up to the emergency department during that week and ask them about whether they'd seen the episode, and if they had seen the episode, to what extent it had influenced their actions. So he interviewed 32 patients who had seen the episode. 20% of those said that it had influenced their decision to take an overdose, and 17% said it had influenced their choice of drug. So fairly good evidence there that in that particular instance, the presentation of that Casualty episode had an influence on those people. So I just thought I'd summarise those studies. I've selected them because they provide good coverage of the kind of studies that are done, but I've selected only 6, as I said, of over 100. But I thought I'd just show you that the ones I've chosen cover 4 decades. So the first one was by Phillips in 1974, the most recent one was by Paul this year. They cover a range of countries, so a lot's been done in the US, and most of the work initially was done in the US, but over time other countries too have produced good evidence. So in the studies I've talked about here, we've got Australian evidence from Hong Kong, Taiwan, South Korea, Austria, Germany and the UK, so it's a worldwide phenomenon. Different media types, so the early studies I talked about were newspaper studies, but there are also television studies, so the Schmidtke and Hafner study and the Horton study relate to television media. The media focus, for want of a better word, also varies by study, so there are news media studies and entertainment media studies. The outcome of interest in most of the studies I've presented was completed suicide, but attempted suicide studies have also been done, including the one that I talked about by Keith Horton. And the level of analysis, the level of data analysis is often done at an aggregate level, so people look at global suicide rates in a particular area and aggregate them up. But there are also some individual level studies where, like Keith Horton's study, where individuals are interviewed about their experiences with a particular media stimulus. So we took all of the studies, we systematically reviewed all of the studies that had been done, and we were fairly confident fairly early on that there was an association. The studies really just do point to this association. We wanted to ask whether that association was causal. So we applied some criteria that get used quite often in epidemiology to look at whether you would describe that association that we found as a causal one. So we looked at whether the relationship was consistent. So we were asking whether the association between media coverage of suicide and an increase in actual suicides is consistently observed, regardless of study design and population sampled. And you can see from the sample of studies that I showed you that I think it is consistent. The vast majority of studies do point in that direction, at least in terms of the news media. I have to say the entertainment media studies are slightly more equivocal. We looked at the strength of the association, and we were looking at whether the association was statistically significant and whether there was an evidence of a dose-response effect, such that the greater exposure to the media coverage led to greater increases in suicide rates. And we found that to be true. So again, that was good evidence of causality. We looked at temporality. So for an association to be causal, the exposure has to happen before the outcome. And the studies do demonstrate that. The media stimulus occurs before the increase in completed or attempted suicide rates. We also were confident that there was specificity, that the association was specific. So it's clear association media exposure was a consistent risk factor for suicide. And the association's also coherent. It makes sense in terms of some of the things we know about suicide in terms of behavioural theory, observers copying models. So to conclude, my colleague Warwick Blood and I did this review in Australia. We felt that the body of evidence really did point to a causal relationship. As I say, at least in the case of news media, slightly more equivocal in the case of entertainment media. Factors associated with the relationship, as I've indicated from some of the studies I selected, were timing, so the effect is greatest immediately after the media exposure and attenuates over time. The amount and prominence of coverage is really important, so big, prominent newspaper items or lead items on television news are more likely to have a copycat impact. The model-observer relationship is important, so celebrities are important. People revere celebrities. People are more likely perhaps to copy celebrities' behaviours. People talk about that being a vertical imitation, and people also talk about horizontal imitation, where people copy others who are similar to them. So you can see from some of the studies I presented that the impact, the increase in suicide rates was greatest among the particular age, sex group that the original index suicide had occurred among. And the method's obviously important. People are more likely to copy the particular method of suicide. You see greater increases in rates of suicide by the method that has been described in the media. So, that's a summary of the research evidence. I really do firmly believe that media reporting of suicide can have an impact on copycat behaviours. So I hope that brief potted summary has convinced you too. I wanted to talk about the development, dissemination and impact of resources on media reporting of suicide. So a lot of people have been thinking about this and thinking that perhaps there are things that can be done to ensure that reporting is responsible. So Australia developed a set of guidelines in 1999, those guidelines on the left, which were called Achieving the Balance, and they were revised in 2002 to our current resource, which is called Reporting Suicide and Mental Illness. And the content of the two is fairly similar, but the dissemination strategy that's gone along with the current resources has been much more targeted and considered, I think, and I'll talk about that in a minute. So we're not alone in having developed resources of this kind that are designed to assist journalists and other media professionals with reporting as safely and responsibly as possible. So without much effort at all, our International Association for Suicide Prevention Task Force on Suicide in the Media had a look at what guidelines were available internationally, and with no effort at all we found 30 very similar guidelines, very similar content, including New Zealand guidelines that are here. So just by way of a quick summary, again, I'm not going to go through all 30 that we found, but the columns here represent, the first column is our resources in Australia, which were developed by our Department of Health and Ageing in collaboration with media professionals and suicide prevention experts. Second column is the Ministry of Health guidelines here. Third column is the Centres for Disease Control in the US, which developed guidelines for the whole of the United States. World Health Organisation guidelines, which our International Association Task Force has just revised, is the next column. And then there are two UK sets of guidelines, one that was produced by the Samaritans, which again has just been revised, and one by MediaWise Trust, which is a media-driven organisation. So all of them, you can see the light blue shading represents whether the particular thing in the row has been, there is evidence of that in the particular guideline or not. So you can see that there's a lot of light blue shading indicating that they do say very similar things. So all of them suggest avoiding sensationalising or glamorising suicide or giving it undue prominence. And that's because of the research evidence that I was talking about more prominent coverage being the most likely to lead to copycat behaviours. So all of them do that. All of them suggest avoiding providing specific detail about the suicide, particularly the method of suicide, but also perhaps the location. All of them recognise the importance of role models, so they make comment particularly on celebrity suicides, and often they make comment on young people who are particularly likely to be influenced by other young people. Two of them, the Centres for Disease Control and the MediaWise Trust resources, talk about taking particular care in special situations, like reporting a suicide in an inpatient mental health unit, for example. All of them talk about taking the opportunity to educate the public about suicide, to not provide really simplistic reasons for suicide, to recognise that suicide's a complex phenomenon. All of them talk about providing helpline information for vulnerable readers or viewers. All of them talk about considering the aftermath of suicide, and by that I mean they all talk about the fact that suicide has a really big impact on family members and others who are bereaved by the suicide. So those people are particularly vulnerable too, and their privacy should be respected. So all of them talk about that sort of thing. And all of them, two of them, just the two UK ones, acknowledge that journalists are vulnerable too, and they make special note of the fact that often it's quite young, inexperienced journalists who are early on in their career who are the ones who do the stories on suicide. I should say that the other very common denominator in all these guidelines and the other 30 across the globe is that none of them are about censoring media reporting of suicide, which I think is a really important point to stress. None of them are saying don't report suicide, but they're saying if you do report it carefully, report it responsibly, report it sensitively. So I can't stress that enough. They're not about censorship, they're about responsible reporting. So, as I've said, they're all very similar in content, but they differ in terms of the way they've been developed and disseminated. And the main difference, I think, is in the way that media professionals have been involved. So some, like the MediaWise Trust guidelines in the UK, were completely driven by the media, and others have had much less media involvement. In Australia, we've had a very targeted approach, as I said, to our dissemination. So our Department of Health and Ageing, which funded our resources, have funded a project to run alongside the resources known as the Mindframe Media and Mental Health Project, which is conducted by the Hunter Institute of Mental Health. And it's designed to support media organisations in their understanding and use of the resources. So rather than just send the resources out and hope that they get somewhere and probably find that they don't and that they sit on maybe an editor's shelf, there's been a really targeted strategy to run face-to-face briefings with media outlets and with individual media professionals, to offer ad hoc advice, to distribute hard and soft copies of the resource and supporting materials in whatever way suits media outlets and individual journalists the best, working with peak media organisations to incorporate aspects of the resources into codes of practice and editorial policies, and providing ongoing follow-up and promotion. So that they've worked really hard. They've been, for the last 4 or 5 years, they've really, I think, made the guidelines quite prominent in the minds of journalists in Australia. So these resources that exist around the globe, there are a number in existence, but to date they haven't been particularly well evaluated. So there was a report by the Institute of Medicine in the US in 2002 which looked at a whole range of suicide prevention strategies, and one of them was, recognising the importance of the media in suicide prevention. They talked about media resources, but they said there's been little evaluation of the extent to which resources have been embraced by and or changed the practices of journalists, and still less evaluation of their influence on rates of completed and attempted suicide. So it makes sense to introduce these resources, given the research evidence that we've talked about, but their impact hasn't been well evaluated to date. There has been a little bit of evaluation. So there was a pre and post study done in Switzerland by Conrad Michel, who found that the introduction of resources led to less sensational and higher quality reporting. And a pre and post study done in Austria by Elmar Etzersdorfer and various colleagues of his, which showed that the introduction of media resources regarding reporting of suicides on the Vienna subway, which was a particular problem for them at the time. There were a lot of subway suicides, and there was quite prominent reporting of them. They worked quite hard. They developed some guidelines and worked with particularly one newspaper, but also a number of others. They found that those resources led to a reduction in the reporting of those suicides and, in turn, a decrease in the rate of subway suicides and in the overall suicide rate. They also found that the positive impact was more pronounced in regions with strong media collaboration. So I think that's a really important point too. It's quite reasonable that, media professionals are professionals. Journalists know what they're doing. They don't want guidelines foisted upon them by non-media professionals. It's got to be a really collaborative thing. We as suicide prevention experts can offer some of the content and the research and the background information, but we're not journalists. We don't know all of the other imperatives that journalists have operating on them. So I think that's a really important finding, that where there was strong media collaboration, the impact was more pronounced and it was largely maintained over time. We've done some evaluation work in Australia. We've had a project known as the Media Monitoring Project. So we monitored the Australian media, so newspaper, television and radio stations, for 2 12-month periods, one before the introduction of our current guidelines and one once they'd been well and truly introduced and well disseminated. So we looked at all metropolitan daily newspapers in Australia and a fairly large sample of suburban and regional papers as well. And we looked at all television and radio networks, but we restricted ourselves with the television and radio networks to news and current affairs items. We just didn't have the funding to look at every single item on those on television and radio stations over the full 2 12-month periods. So we analysed the items looking at the extent of reporting, just how much reporting on suicide there was, the nature of that reporting, what kind of reporting was going on, and we developed a quality rating scale which was based on the various criteria in our guidelines. We operationalised them into a rating scale that let us look at things like whether the method of an individual suicide was being reported. The other thing I should say is that we did a fairly broad sweep, so we collected all media items on suicide, not just items about an individual suicide. So, for instance, some of them were about statistics relating to suicide and some of them were about policy and program initiatives in the area of suicide prevention. So 2 12-month periods. So we found over the 2 12-month periods that there was almost a twofold increase in reporting. So in 2000-2001, we found almost 5,000 items. By 2006-2007, there were about 8,500 items. And I think that's really quite interesting because, as I was saying before, the guidelines aren't about censorship. So the guidelines haven't reduced the amount of reporting on suicide. And in fact, the amount of reporting has increased. But as you'll see in a minute, the reporting's got much better. The nature of media reporting showed some variability over time. So there were lots of different kinds of reports. But in the later period, there was an increased emphasis on items about individuals' experiences. So either individual suicides or people who had been bereaved by suicide, for example. And there was a reduced emphasis on policy and program initiatives. So the quality stuff, I won't go through all of our quality ratings, but I'll just give you some examples. So one of the things we asked was whether the item has had any examples of inappropriate language. So by that, we meant things like, and this is the kind of things our resources say, it's perhaps not a great idea to use the term successful suicide because that implies that a death is a desirable outcome. So we were looking for language that we felt was inappropriate. And in 2000-2001, nearly 42% of all our items had some kind of example of inappropriate language, but by 2006-2007, only about 6% did. So that was a good thing, good change in the tone, I guess, of reporting. We asked, is there a detailed discussion of the method used in the given item? Obviously, this wasn't appropriate in the case of all items. If it was an item about suicide statistics, that didn't make sense. But in the items where it was sensible to ask the question, in 2000-2001, almost 50% of items described the method in detail that we thought was inappropriate, but by 2006, 2007, only 14% did. So again, that was a good improvement. We also asked whether the item provides information on help services, which in 2000, 2001, we were really surprised to find that only 6.5% of items did. It seemed to us, and again, this may be coming from our perspective as non-media professionals, but that seemed like a fairly simple thing to do. And it's improved over time, so now about 18% of all our media items we identified included some sort of helpline information, often a number for Lifeline or Beyond Blue, our National Depression Initiative. So we took all of our quality rating criteria, there were actually 9, but I've only showed you 3 there, and developed a total quality score for each item. And without going into the details of how we did that, the upshot of it was that a score of 0 was the worst possible quality and a score of 100 at this end of the graph was the best possible quality. So you can see the darker bars are the more recent time period, the lighter bars are the earlier time period, and there's been a shift to the much better quality items. The peak is much further along the graph. So overall, we're confident in saying that the quality of reporting has improved, we feel. So I just thought I'd provide a little by way of summary and conclusions relating to the initial questions I asked. So in terms of what we know, I think we do know that there is a clear relationship between media reporting of suicide and actual suicidal behaviour, and I think that relationship is a causal relationship. We also know that a number of countries have developed resources on media reporting of suicide to encourage responsible reporting. Again, I stress not to censor reporting, but to encourage good, safe reporting. All of these resources are similar in content, but they vary in the way they've been developed and disseminated. And the other thing we know, I think, is that reporting of suicide in the Australian media has improved in quality since the introduction of our resources, and probably more importantly, since the good dissemination of those resources. What we don't know, though, there's still quite a lot we don't know. We don't know sufficient about journalists' experiences with reporting suicide and with using media resources, and whether the resources are easy or difficult for them to use, what other imperatives are operating for them when they are reporting a suicide over and above this set of resources they might have next to them. We also don't know sufficient about how members of the public interpret media information about suicide. There's a lot to learn there about how particularly perhaps different population groups, particularly vulnerable groups, interpret information that they read in the media about suicide. And we don't know sufficient, although, as I said, there are a couple of evaluations that have been done before our work, and we've now done some evaluation of our resources in Australia. We really don't know sufficient about the nature of the impact that media resources might have on journalists' reporting practices and on rates of completed or attempted suicide. So thank you, that's it. I think I might have beaten Sarah's bell.
Easy.